Thank you very much for your comment. I think it adds valuable contribution to this conversation that we're having about the ban of Mogoka in Mombasa County. You're saying here at Portrees is a mental hospital in Mombasa County. 90% of patients have substance use disorder. So these are different substances, I assume. We have alcohol use disorder, heroin use disorder, cannabis use disorder, cocaine use disorders, and many others. And the main drug abused is Mogoka, meaning at this point, currently, the biggest numbers that perhaps they're admitting, according to her clinical experience in Portrees, are because of psychosis associated with Mogoka or other problems associated with Mogoka chewing. And so now it's the most commonly abused drug. I know that people have raised concern about the other drugs like heroin and cocaine and the rest, but the conversation we're having at this point, in this moment, is about the ban of Mogoka in Mombasa County. Perhaps if there's going to be another conversation about cocaine and heroin in Mombasa County, then we can engage in that conversation. But at the moment, one thing at a time, we're looking at Mogoka. And for those who have encountered the negative effects that cause psychiatric complications or mental health complications, then they would understand the logic in banning Mogoka in Mombasa County. Because what we're saying is an instant effect of psychosis associated with chewing Mogoka. So after a person chews, immediately they start experiencing symptoms of hallucinations. They start seeing things that are not actually there. They start hearing voices of people who are not actually there in their immediate environment. Those are hallucinations. Delusions is a person believing in something that is not actually true, that there's no evidence to support. So we're seeing delusions of paranoia, where a person thinks that other people are out to harm them. They have this fear that something bad is going to happen to them, someone wants to harm them. Delusions of persecution, similar to delusions of paranoia. Delusions of grandiosity sometimes, where a person has these grand ideas about things that may be bizarre or non-bizarre, but do not actually have any evidence to support the beliefs that they have. We have patients presenting with aggressive behavior where they intend to harm another person, or they go after another person to try to hurt them physically. We have people presenting with symptoms of destruction of property because of the psychosis. And psychosis is the effect after using chewing Mogoka in this case. And so for family members who've had a relative with the psychosis as a result of using Mogoka, they would actually see the sense in banning Mogoka. For mental health practitioners who've had encounters with patients presenting with these aggressive behaviors or psychotic symptoms associated with just the use of Mogoka, they would see the sense in banning it. Because what we are learning is that Mogoka is one of the cheapest drugs that you can get now. I'm hearing that you can get a bundle at 30 shillings or 50 shillings, and you don't need to chew a lot of it to get the stimulation. So compared to Mira, you might sit for maybe an hour or two or even 3 to gain the stimulation, to get the euphoria, to activate your brain reward system. But with Mogoka, you need maybe 30 minutes or less. And so you achieve rapid stimulation with Mogoka than you do with Mira. And that stimulation is more intense than the one that you get with Mira. And so because of the intensity of the effect of Mogoka, I don't know, we still need to do research. It might be the one contributing to the onset of psychosis in a person chewing Mogoka. And here my focus is Mogoka, so slip of the tongue, please forgive me for that. And so for people who haven't seen the ugly side of Mogoka, they probably would tell a different story, and that would be from their own experience. Just like the way, from my own experience, I can see the negative effects, the adverse effects, the ugly side of Mogoka, and that's why I would go on to support the ban of Mogoka in Mombasa County.